How is jaundice diagnosed by a doctor? Imagine noticing your skin or eyes turning a yellowish hue. That's often the first sign of jaundice, a symptom that can point to various underlying health issues, especially related to the liver. When a doctor evaluates jaundice, they start with a detailed medical history. They ask about when the yellowing began, if it's gotten worse, and if there are other symptoms like dark urine, pale stools, fatigue, or abdominal discomfort. These clues help narrow down the cause. Next, the doctor performs a physical exam. They look for yellow discoloration in the skin and the whites of the eyes, which is a hallmark of jaundice. They also check for signs of liver enlargement, tenderness, or swelling in the abdomen. Sometimes, they might feel the liver to see if it's enlarged or tender, which can suggest liver inflammation or other issues. Laboratory tests are the cornerstone of diagnosis. Blood tests measure bilirubin levels, which is a yellow pigment made when red blood cells break down. Elevated total bilirubin confirms jaundice. The tests also break down bilirubin into direct, conjugated, and indirect, unconjugated forms. This helps determine whether the problem is related to the liver's ability to process bilirubin or if there's an obstruction in the bile ducts. Liver function tests are also important. They measure enzymes like alanine transaminase and aspartate transaminase, which increase when liver cells are damaged. Elevated alkaline phosphatase and gamma-glutamyltransferase can indicate bile duct blockage or cholestasis. A complete blood count can reveal anemia or signs of hemolysis, which can cause prehepatic jaundice. The prothrombin time, or INR, assesses how well the liver is producing blood clotting factors, which can be impaired in liver disease. Serum albumin levels give insight into the liver's ability to make proteins, and a hepatitis panel can identify viral infections like hepatitis B or C that might cause liver inflammation. If blood tests suggest issues with the liver or bile flow, imaging studies come into play. An ultrasound is usually the first step because it's quick, safe, and effective at detecting gallstones, bile duct obstructions, or liver masses. If more detail is needed, a CT scan or MRI can provide clearer images of the liver and surrounding structures. Magnetic resonance cholangiopancreatography, or MRCP, is a specialized MRI that visualizes the bile and pancreatic ducts without needing invasive procedures. In some cases, doctors perform an endoscopic retrograde cholangiopancreatography, or ERCP, which combines imaging with the ability to treat blockages directly. In certain situations, especially if the diagnosis remains uncertain, a liver biopsy might be performed. This involves taking a small tissue sample from the liver to examine for inflammation, fibrosis, or cancer cells. It provides valuable information about the extent of liver damage and helps confirm diagnoses like liver cancer. In the context of liver health and liver cancer, early detection of jaundice and its cause is vital. Elevated bilirubin and abnormal liver enzymes can point to liver cell injury or bile duct obstruction caused by tumors. Imaging helps identify liver masses or blockages linked to cancer. Because jaundice can be caused by many different conditions, from benign issues to serious diseases, a thorough and individualized approach is essential. Prompt diagnosis allows doctors to develop the best treatment plan, aiming to preserve liver function and address any underlying cancer effectively. Always remember, if you notice signs of jaundice, consulting a healthcare professional promptly is the safest step to ensure proper care and diagnosis.